And so this last case is another lobar net neuroendocrine tumor patient. A large amount of my practice is neuroendocrine tumor patients, so I'm a little bit biased towards that. And so here you can see this patient has a 6.7 centimeter tumor kind of in the posterior sector. They also had numerous bilobar smaller tumors. So this patient ultimately was going to need staged bilobar therapies. But I'm really going to highlight this larger tumor because I think that the effect was quite dramatic. If you look at my first conventional angiogram, I think you can see it there. It definitely is enhancing. And so we thought we were good to go, just an end hole catheter. So we infused our MAA. And if you go to the next slide, we kind of freaked out because you can see at our MAA, we just had no preferential uptake to the tumor. The uptake was into the background liver. T to N ratio is essentially 1, where we just didn't see anything into that large tumor.
Did you have a cone beam from that prior to the MAA?
Yeah. And it looked essentially like how the MEA looked.
Okay. Got it. Okay.
So I had a sneaking suspicion that was going to be the case. Now they actually have a CPT code that you can use during the mapping procedure to get reimbursed for using like a TriNav, for instance. So I probably in the future would have used it there, but they didn't have a code then, and so I didn't use it. But I knew I was going to use the microvalve when I brought him back, because if nothing happened, whatever. But I know if I can get any increased uptake into the tumor, anything at all is going to help this scenario, right? And so you can see we used a microvalve. We treated from exactly the same position, just a right lobar infusion at the time of Y-90. And as you can see here, this is our uptake spec CT from the Y-90, where you can see really dense uptake inside of the tumor. This looks identical to the paper that I was referencing earlier, Jarek et al. In JVIR from last year, where you can see when they took oncopigs and used both end-hole microcatheters and the microvalve catheters, they saw similar pictures just like this. So you can call BS all you want. Do I see this every single time? No, but you see this a couple of times, and you're sold that this is clearly going to hopefully benefit patients.